Hello and welcome to the Dizziness and Balance video series by the Ear and Balance Institute. I am your host, Dr. Jared Gianoli, and I am a board-certified neuro-otologist. Neuro-otology is the medical specialty that deals with inner ear dizziness and balance disorders. This video series is intended to be educational and not intended to be medical advice. For individual medical advice, please speak with your own physician. In this video, I will be discussing Meniere's disease. Dr. Prosper Meniere was a French physician who lived in the early to mid-1800s. He was the first physician to identify vertigo as being caused by the inner ear. Consequently, Meniere's disease bears his name. It is one of the many disorders that can affect the inner ear, resulting in varying degrees of hearing loss, tinnitus, and vertigo. But before we talk about Meniere's disease, let's talk about a couple of definitions. First of all, the word syndrome. The word syndrome means a collection of symptoms. They don't necessarily mean a particular diagnosis. They may mean several diagnoses. The word Meniere's syndrome is a collection of 4 symptoms. Number 1 is fullness or pressure in the ear. Number 2 is fluctuating hearing loss, usually low frequency fluctuating hearing loss. Number 3 is tinnitus, but there's a lot of different kinds of tinnitus. Meniere's disease typically has a low-pitched sound of the ocean roaring type of tinnitus. And the last is vertigo, episodes of spinning sensation that last 20 to 30 minutes, or more typically 2 to 3 hours. Meniere's syndrome can be caused by a lot of different things. However, if we cannot identify a cause, we call it Meniere's disease. So someone with Meniere's disease has all of these symptoms, yet we don't know why. Meniere's syndrome, as I mentioned, has a whole bunch of different causes. Among these are skull-based tumors, strokes, blood vessels or cysts pressing on the hearing and balance nerve, allergies, autoimmune disorders, middle ear infections, cholesteatomas, migraines, head trauma like concussions, anatomic defects of the inner ear, either genetic, developmental, or acquired, genetic causes, obstructive sleep apnea, viral infections, and many, many more. So by definition, Meniere's disease has no known cause, or at least no cause that can be determined. Identifying the cause is more than just an academic point. Identifying the cause allows us to focus the treatment on the cause and greatly improves the success rate in treating Meniere's disease. If we don't know the cause, we're relegated to nonspecific treatments that may or may not resolve the problem. The first step in evaluating Meniere's is looking through a very detailed investigation of possible causes. Usually your doctor will get a detailed history, examine you, typically get a hearing test, and then an MRI scan. This will typically evaluate for the most serious causes, or at least the life-threatening causes. But there's many more tests that can be employed, and most of these are geared toward the patient's history. If these are all normal, and the comprehensive evaluation is still normal, then we're relegated to the diagnosis of Meniere's disease. Sometimes doctors don't go beyond an MRI scan, and this can lead to suboptimal treatment outcomes. Well, what is actually going on in Meniere's disease? The inner ear has a bony capsule that inside that has 2 different components, 2 fluid spaces separated by a very thin membrane. The first is the endolymphatic space filled with endolymphatic fluid. The other space is the perilymphatic space filled with perilymphatic fluid. In Meniere's disease, the endolymphatic space expands while the perilymphatic space contracts. We call this endolymphatic hydrops, and this is believed to be the pathologic mechanism for Meniere's disease. The initial treatment for someone with Meniere's disease is something we call symptomatic care, and it's basically just taking care of the severity of the symptoms associated with it. And it's mostly treatment of nausea and vomiting. Some patients have such severe nausea and vomiting that they may require a short hospital stay and intravenous fluids to prevent dehydration. The other treatment for Meniere's disease is preventative treatment, and this, of course, is meant to prevent the spells of Meniere's. These include both medical and surgical treatments. However, we almost always start with the medical treatment. The medical treatment is typically geared toward reducing the fluid retention in the inner ear, and the two main ways of doing that are diuretics, which help remove fluid from the body, and a low-salt, caffeine-free diet. Other medical treatments directed toward Meniere's disease are directed toward the probable cause for the Meniere syndrome. If, for example, allergy is found to be one of the triggers or causative mechanisms, treating the patient's allergy would be part of their therapy. Surgical treatments are geared toward those folks who do not respond to medical therapy and have severe problems. Among the surgical treatments, there are basically divided into two groups. There's preservation procedures, and there's destructive procedures. The preservation procedures are those that try to preserve the inner ear function and try to make it better or improve it. The destructive procedures are geared toward eliminating the inner ear so you no longer get the vertigo spells. The two preservation procedures that I would report to you are the intratympanic steroid perfusion. This is a very minimally invasive approach where the doctor injects through the eardrum to the middle ear steroids. The steroids get absorbed into the inner ear and help reduce the symptoms of Meniere's disease. The advantage of this approach is it's very minimally invasive and can be done as an in-office procedure. The downside is it's got a low, probably the lowest success rate of the surgical procedures, and even when it does work, it often is temporizing and that has to be done again and again. The other preservation surgical procedure is endolymphatic sac surgery. This is surgery done on the endolymphatic sac of the inner ear, which is located behind the mastoid. There's a whole variety of procedures performed on the endolymphatic sac, but the basis is try to reduce the pressure on the inner ear. The advantage of it's a much higher success rate than the steroid perfusion. The disadvantage is it is a formal surgical procedure that requires general anesthesia and usually an outpatient surgical stay. The destructive procedures, as I mentioned, are geared toward destroying the inner ear, and there's three basic ways of doing this. The first is the intratympanic gentamicin perfusion. Similar to the intratympanic steroid perfusion, the doctor will inject the gentamicin through the eardrum into the middle ear. Gentamicin is an antibiotic that is toxic to the inner ear. So when it gets to the inner ear, it can destroy the sensory cells and reduce the problems with vertigo. The second is labyrinthectomy, and this is a surgical procedure where we actually go in and drill out and destroy the inner ear. The last is the most aggressive, and that's a vestibular nerve section. In that, we go in and cut the balance nerve and basically separate it from the inner ear. It doesn't change what happens in the inner ear, but it prevents those abnormal balance signals from getting to the brain and causing the vertigo spells. It is, as I mentioned, the most aggressive procedure. It requires a craniotomy and usually a several-day hospital stay. So in summary, Meniere's syndrome can be caused by a lot of different things, and the first step in evaluating Meniere's syndrome should be looking for a cause. If we can't find a cause, we call it Meniere's disease. And as I mentioned, there's a variety of different medical and surgical treatments for it. For more information on other inner ear disorders, please see our other videos. Thank you.